I'm Christine Colella, and I'm here with Dr. Lindsay Davis, and we're going to just go through the issues and questions that come up about being a preceptor. So we're really glad that you're here. If you could text any questions that you have in the chat, we'll be able to answer those questions as well at the end. So why do we care about preceptors? Why do we need people to be preceptors? Well, as per the AACN, which is a body of the American Association of Colleges of Nursing, there's a true recognition of the need for primary care providers. And in order to meet the need to increase access to care, we have to make sure that we have nurse practitioners that are out there to care for these patients. And this has led to an increased enrollment of people in the NP program. And what that means is that we need people to teach them and be out there with them in that clinical setting. And that's one of the largest things that most of the schools report. 65%, as a matter of fact, report that finding adequate preceptors to help educate the NP student is one of the biggest problems with us being able to admit students into our programs. It's a true barrier. So we want to make sure that we have qualified and involved preceptors with our students. And we're also in competition with medical schools looking for preceptors for their med students, with the for-profit schools that are looking for people for their PA programs and other kinds of programs. So we really need to make sure that we have people out there to precept our nurse practitioner students, because this is going to be a continued increase in enrollment. So that's what we're going to talk about today. So upon completion of this webinar, the learner hopefully will be able to describe the role of the preceptor, identify methods to create a quality learning experience, and that's really important, and we're going to spend some time on that, and examine the value of being a preceptor. And we're very, very lucky to have Julie Shelton, who is here with us today, to talk about what it is to be a preceptor and what's good for her and what she finds that she gets out of the role. And that's going to be very, very enlightening. And then we're also going to outline some steps to becoming a preceptor, because that's what we really want. We want people to get excited about being a preceptor. And also, too, if you're a student who's listening to this and you're trying to find preceptors or talk to people about being a preceptor, this will be very informational for you, because you'll be able to explain to them some of the questions that they might have.
So what is a preceptor? And I think to start off, I think it's important to discuss exactly what the role of the preceptor is. And the preceptor truly supports the student learning experience. They're providing education and direction in the clinical setting. These students already have a faculty, so they're already getting course assignments and they're getting guidance within the actual course, but your job is to guide them in the clinical setting when they're making clinical decisions in a clinical setting. And the preceptor also delivers a personalized education, and they do that through linking theory and evidence-based practice. Sometimes there's pushback from managers or administration because they have concern that it might decrease productivity, and there's just not evidence to support this at this time. It's more of a perception. The preceptors or administration often perceive that this perhaps could decrease the productivity of the provider, but there's just not a lot of evidence out there that supports that notion. And you might find initially that when you begin working with the student, it may be a slow process in the beginning, but if you really begin to utilize the student appropriately and you utilize the student in the right way, the student is gaining a great experience, and it can end up being a really valuable experience and to your advantage and be very productive for you as a provider.
I think, Lindsay, that's exactly where people have to really push the point, because yes, it is a little bit slower in the beginning, which is where management might say, oh, but they're going to slow you down. But then when the student gets up to speed and the student's able to go in and see a patient and get knowledgeable about your process and your workflow and your charting, then it really does help that preceptor. And that's one of the things that we want our preceptors to be able to verbalize and educate their management system about. So it's really important.
So who can be a preceptor? And I think it's important to start off by talking about the qualifications of who is qualified to precept students. And nurse practitioner students are precepted by either a nurse practitioner or a certified nurse midwife. These are advanced practice registered nurses that are qualified to precept a student. They can also be precepted by physicians, so either an MD or a DO. They are not able to be precepted by physician assistants, and because the reason for that is the difference in roles and the difference in the scope of practice between the physician assistant and the nurse practitioner. Preceptors need to have a minimum of 1 year of experience in the clinical setting to be able to precept a student. And usually what takes place is a letter of agreement is established between the University of Cincinnati and the clinical site, between the two sites, so that we can make sure that the student is properly onboarded for the clinical site and that all of their critical requirements are up to date, so that they can be active in the clinical setting.
And one of the big questions that people often ask is, what is the commitment? What do I, as the preceptor, have to do for their student from a time standpoint? And also sometimes they are concerned that they have to grade papers or they have to do that kind of thing. And that really is not part of the commitment. As Dr. Davis said, they have a faculty who is also assigned to them and is involved in assignments and grading and that kind of component to it. But what the commitment is for the preceptor is being in that clinical setting, and it varies. It varies from course to course, or practicum to practicum, and we do always want every preceptor to know that this is not an observation experience for our students. This is not a shadowing experience for our students. This is a hands-on experience that lets them truly see, watch the role certainly, but then do the role as well. And that's why there's a minimum of 60 hours in any clinical setting. We feel that if a student does less than that, they're really relegated to that observational or that shadowing role, which is not what we want. So depending on the amount of hours, and it could be anywhere from 60 to 150 or more, depending on what you and the student have arranged for. And the clinical hours are completed over a semester. And it's very important for the preceptor to know that the student will accommodate what the preceptor can give them, not the other way around. So we certainly want students and preceptors to say, when they can be there. So we want the preceptor to say, well, I can take you on Tuesdays, and our student will very gratefully say, yay, I can be there on Tuesdays. But it really is a experience that both enhances certainly the student. We know that the student gets so much out of this, but it also is great for the preceptor as well. It reminds you of why you went into this in the first place. You can get some of the enthusiasm of these new students that are just learning the role, and then ask some good questions, and it makes you think about, well, why do I do something? So it really is, the commitment comes from working with the student for the time that they're there.
So to sort of deconstruct preceptorship and how we maintain academic practice partnerships and partnerships with our preceptors, I think it's important to discuss the incentives and barriers to preceptorship. And the incentives and barriers are very well documented in the literature, and as a College of Nursing, we're aware of these barriers to preceptorship and what motivates preceptors preceptors to offer these experiences for our students, and we're dedicated to improving the incentives, and we're dedicated to really breaking down the barriers. So many of actually the top incentive that is documented in the literature is the opportunity to give back to the profession. It's more of an inherent drive to precept because they feel like they are giving back to the profession and adding to the value of what they believe is they're passionate about the profession, and they're adding to the student experience and the future of the advanced practice nurse. It also provides an opportunity to remain current and up to date with practice because we learn from each other, right? So we're exchanging information. The student perhaps is coming in with new information, and they're sharing information with the preceptor. And I think it's interesting to find out how much you learn as a preceptor when a student is actually coming to you and actively asking questions, and they're engaged in the experience, and they're engaged with the patient. And so I think you actually find a drive to learn from yourself in that aspect as well. And then, of course, it's important to point out that many of the certifying bodies, such as the ACN or the ANCC, and the AMP, that they will offer credit towards recertification. And so I encourage each of you to look through your own certifying body and find out how you can get credit towards recertification.
On this point, there was just I don't know if it's a law, but a requirement passed in Michigan with the Board of Nursing that they're going to give CE credit. You know how we all have to have so many credit CEs for education when we renew our state licenses. And Michigan is giving NPs who precept credit for that, which I think if you're out there across the country, you can certainly think of that or look that up and go to your own state board of nursing and see if that's something, because that would be a wonderful thing for us to have to incentivize preceptors. And but that was the first one that I had heard of.
So, and just to touch on the barriers quickly, the pressure to maintain productivity, I've touched on that briefly in the previous slide, that we don't have evidence that accepting a student or precepting a student in the clinical setting truly impacts productivity. There's just not evidence related to that at this time. And then, of course, the concern that maybe you don't lack the experience to teach a student, but really there's no better time we're all learning from each other, and so you do not need to be an expert to be able to work with a student. You just have to have the passion for mentorship, to be able to just engage with the student and really just dive in and learn from each other. And then, of course, there is concern from preceptors that there's limited faculty engagement. And here at the University of Cincinnati College of Nursing, we really strive to overcome these barriers, and we're working hard to put strategies in place to overcome these barriers. And our faculty are very much engaged. Much of the time, for our on-site students, the faculty are able to make in-person visits in the clinical setting and touch base with the student and the preceptor in person. And then, of course, for our distance learning students, usually receive a phone call from faculty at some point within the semester. Preceptors also receive direct contact information with for the faculty members, so that they have at their fingertips, they have contact with email and office phone numbers, so that they can get in touch with anyone at the College of Nursing.
So what does a preceptor do? Well, there are certain expectations for the student, for the faculty, and for the preceptor. Our expectation of the student is that they will come prepared and have, looked up things and are ready there to learn and to pitch in, and know that they're there because the preceptor has welcomed them into that particular environment. And so, like any guest, they're going to be the best guests they can be. We really stress to the students how lucky they are to have a preceptor and how they are really, truly there to learn from every possible way, and to not be a passive learner, but be an active learner. So they're in there able to ask questions and follow up on things and truly get the most out of the experience they can. The faculty from the College of Nursing, our expectation is that we are there to certainly answer any questions the preceptor has, any concerns the preceptor has. We always do check-ins to make sure that the student is able to, has been showing up and has been responsible and accountable and has been an active learner. And we are also there for the student, if the student has any questions or any issues that they need to deal with. The faculty is also the person that is grading all the assignments and who will be giving the final grade to that student with preceptor input. And then the preceptor role, as we have mentioned, is to be that person on the ground, hands-on, sharing with them their knowledge and also learning from the student, as well as mentoring and teaching the student. And the expectation is that they have the time to give the student, that they have the desire and passion, as Lindsay said, to give, to share with the student the knowledge that they have. So there are definite expectations for all of the components, all of the people in this triad of a relationship. And one of the things that the faculty does when they send out that first welcome is to not only share the syllabus, which has the expectation for the student, but also a responsibility sheet that shows what everybody's role is and what their requirements and expectations are.
So there are several published teaching methods which provide structured techniques for the preceptor and the student. And I would encourage you as a preceptor to look into these techniques to use in the clinical setting. And our students are actually trained to implement these techniques in the clinical setting. The SNAPS technique is a published self-directed or student-directed learning technique in the clinical settings where the student learns how to present a patient to the preceptor in a very succinct manner. It's a step-by-step approach, and at the conclusion of the SNAP technique, they are actually telling the preceptor, they're figuring out which questions are important for the preceptor to ask the preceptor to learn more about the student or learn more about the patient and how the patient's presenting and that diagnosis or illness. And then at the end of that, they're actually telling the preceptor what they're going to go home and learn more about at the end of the day. I think it's important to consider also in your teaching method that at the beginning of the day, perhaps sit down and look at your patients for the day and figure out which patients would be most appropriate for your student to see. And then that student is prepared for which patients they will see for the day, or perhaps if the student's coming on 2 consecutive days, they could do that on the evening before, or the day before. So we almost suggest pre-planning, almost in a huddle format, so that you can sit down and have a plan and with the student, so that will create an even more positive learning experience.
So we really do try to support the preceptor as much as possible. As we've talked about, there are certainly barriers. There are certainly sometimes preceptors feel that they're out there on their own or by themselves, and they may have questions, but they don't know what to do or who to ask. And that's why we really one of the strong roles for the faculty is to make sure that there is that direct contact with the preceptor. We send out, matter of fact, we're doing that right now. We send out a welcome. I always talk about what my role is, and my contact information is there. We make personal phone calls and site visits if it's possible, to evaluate student progress and address the concerns. But what we really, truly want is that the preceptor knows that they are not the only person taking care of his student, that there is a faculty person who is there and is expected to make those kinds of contacts. Because sometimes, some students, everyone struggles at one time or another, and sometimes there might be an issue with a student where there's a concern from the preceptor, and we want to set the mood where that preceptor knows they can just email or pick up the phone, and there'll be someone who will answer their questions or listen to their concerns. And so one of the ways that we do that is to make sure that there are truly defined goals and expectations for the experience. And one of the things we ask the student to do at the very, very beginning is to sit down and go over their syllabus with the preceptor, and also to develop personal goals for that experience, and then go over those with their preceptors, see if these are things that are possible, to see if these are things that are doable in the time frame or in the setting that they're in, and work on those together. And that way they both have they both know the end game. They both know where they're going to be at the end of the semester.
I think it is important to just touch on the fact that it's okay if you have no prior teaching experience. This is really more of a mentoring, coaching experience, because if you consider where the graduate student is in their career, this is much more of a self-directed and focused experience for the student. The graduate student is unlike the graduate student has already been a nurse in the clinical setting, and so they have a good foundation of knowledge of the patient and disease processes already. And I encourage you to just possibly think back on your experience as a student and what made the good preceptors really great, and what made you feel really good as a student, what made some of your clinical experiences great. And lastly, it is important for us to point out that we do have a large program. We're responsible for an adult gerontology NP program, primary care NP program, family nurse practitioner program, acute care nurse practitioner program, among others. But all of our adjunct and faculty who are part of these programs maintain active clinical practice. And so although we have large numbers of students, each of these students are personally assigned to faculty, so that we're really breaking down those numbers, and they're working with a faculty member who is also active in clinical practice. And so they're also able to help the student and the preceptor have a really great experience.
So what we'd like to do now is welcome Julie Shelton, who is a nurse practitioner here in Cincinnati and has taken students for us very, 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 very many times. And Julie, would you like to just share a little bit about yourself?
Hi, so I am a adult gero primary care nurse practitioner. I graduated here from this program not so long ago, but I do work within the UC system, so I feel like, we're all UC. It's a really great support system, and I've had, good experience with, the College of Nursing, graduating here and also coming back to Precept. So
great. Well, thank you. So tell us about your experiences as a preceptor. What do you like? What don't you like? What do you think could be done to make the experience better for the preceptor?
Luckily I've had pretty great experiences as a preceptor. Like you touched on, so some of this may be redundant. Students that are coming to you in an NP role or in an NP program are not your undergraduate students that you remember having as an RN, in your past life. So it's a breath of fresh air. They're prepared in this program. There's clear expectations, like they went over. And I really like the experience of feel like I'm making it come together for them. Most students are used to an inpatient setting. That's where a lot of RNs practice. So transitioning and seeing it click into that outpatient experience was something I feel like I struggled with, and I kind of like leading them in that direction. And I feel like, they touched on the slowing down. I think selfishly sometimes preceptors can feel that way, but again, it's transient. It's the first week maybe that, they're kind of getting their bearings, and we need to be gracious and allow that. We were all there once. When you agree to be a preceptor, yes, they're needed, but I feel like the college has been really great, with life stuff. Like I've had a baby within the last year and a half, and I said, I love precepting, but I need to take a semester off, and that was absolutely fine. So I could really focus on my family at that point.
Mm-hmm.
So really willing to work with you.
Well, thank you. Yes, I agree. I think that it is. I love that when you mentioned that you help them kind of put the pieces together and connect the dots, because there is a learning curve as the expert bedside nurse, registered nurse. There's a real learning curve between transitioning from that to the novice nurse practitioner. And I think I agree with you. I think that once you start to connect the dots, I think that it's really valuable and rewarding experience for you to witness that. So can you tell us maybe about a difficult experience that perhaps you had with a student and how you handled it, or how you received help from faculty?
Personally, I really haven't had an experience where I've had to reach out. However, I have taken students for additional hours. So often, if you have concerns and you reach out to faculty, those students need to do some additional hours, maybe with a different preceptor. Sometimes it's, a communication issue, maybe just a personality issue sometimes as well. So I've taken students for maybe like an additional 40 to 60 hours, and I feel that faculty's been very receptive to our input and comments. So I think with difficult students, it's really a perceptive thing, and just reaching out to faculty when you need to, and keeping that communication open with them.
I think that's absolutely key, is that what you just said, that keeping the communication open. Because a lot of times I think preceptors are not fearful, but are a little uncomfortable with a student that may not be performing as they think they should, or as they would hope that they would. And sometimes their expectations may be a little too high for the student as well, because the students come in different packages and at different times. A student who is almost finished is very different than a student who's just starting. And so getting that communication piece open and flowing is really, really important. And preceptors, we just want preceptors to know that they can reach out with any kind of an issue. That's great.
So as you started to touch on expectations, can you talk a little bit about the expectations that you have for students? What do you expect from students when they come into the clinical setting?
So beyond the obvious professional, like I expect them to be on time and know where they're going, things like that. I expect them to show up prepared. They should have their materials with them. Sometimes I'll forward some documents prior and say, here are some articles that I referenced quite a bit when I first started, or I work in a setting where we have some kind of risk stratification scoring systems and things that aren't seen every day, and I'll send that material on. So I expect them to come at least having read that and reviewed it.
Do you have any expectations for yourself as a preceptor?
The expectation of myself is just to be patient, I think, and to kind of guide them and lead them through the experience, and to offer feedback. So I go into it and I want to be as prepared as possible. So when you touch on, this being a learning experience for the preceptor, it certainly can be, So if I see something, I'll always kind of look the day before if I have time, and kind of say, at least what does my morning look like? And then I can say, I'm looking at the results of cardiac testing, and I can say, well, why does it affect that? So it makes me be on my toes, so I'm ready to explain to the student, this is the patho behind this. This is my thought process that led me to this plan.
And one of the things too, I think that we preceptors need to know is that what you said, sending them articles or something like that. Sometimes you don't want to just answer all their questions. Sometimes you want to say, I'm not sure either. Why don't you look that up and bring something, a reference or something back, just so the student, that's part of that active learning. Sometimes, we want to kind of open their heads and just yell everything in, but, they have to be actively involved as well. And so I think that's great that you send them things ahead of time, because that really does make a difference. And we want preceptors to know that they're able to do that, that it is certainly part of their role.
So how do you start your day with a student? And what's your typical day like?
So when on my typical day, I'm seeing 8 patients. So I see 4 in the morning, 4 in the afternoon. It's a pretty thorough, they're hour visits. We're doing an entire review of their health history. We're touching on every diagnosis that they have. So again, if I have some time the day before, I will go through and make sure that I'm familiar with the patient, the testing they've had, what's going on with them. So when they first start out, day 1, I do an entire day of shadowing, where they're kind of, they're expected to see what I'm charting or discuss my thought process. They'll watch me. Day 2, I want them hands-on. That's the expectation of a graduate program. It's not observational like they said before. So we're doing exams day 2 on every patient, maybe starting to gather some elements of the HPI, and then kind of building from there what I can see that they're comfortable with.
Yeah, I agree. And then do you have any advice to give to the novice preceptor? Talk a little bit about what you think the value might be in being a preceptor, and if there's any, if you feel that there's anything you'd like to share with a new preceptor, someone who's not new to this role.
I think my biggest advice would be to be prepared. You owe that to yourself and the student. So again, giving them some material that you found helpful, giving them, going through your charts before, but then also, like Christine said, admitting maybe when you don't know something, it's okay to not know. So, if you're a novice preceptor and the students are bringing a lot of great questions to you, and if they're asking a question that you really don't know the answer to, taking pause and saying, I don't know, but we can certainly look this up. We'll figure this out together. Just understand that you're not expected to be an expert on everything, and they're going to bring some questions to you that you won't know the answers to, and that's okay.
Yeah, I think one of the things I often tell students to do when they're in when they're with a preceptor is when the preceptor makes a decision or comes up with a diagnosis or whatever, and especially with a new student, is to actually say to the preceptor, how did you get to that point? How did you connect those dots that you were talking about before? Because it's important for the student. It's not just, this is not a role or this is not a job that's skill-based. It has skills in it, but it's really the thought process piece that is so imperative. And, getting a student to see, well, I decided on this diagnosis because I heard this in the history, I saw this in the physical, I looked at this in the diagnostic testing, and this is what I came up with. Because you're so used to that because you're an experienced NP that sometimes you forget that was a process you had to learn too.
Exactly. That's one of the big leaps from RN to APRN.
Exactly.
Yeah.
It's that. So I think showing them that those crumbs along the way that come together. But I always tell students, ask them, wow, how did you get there? Why did you decide on that antibiotic? Well, because this, that kind of thing. So I think, and that for someone who is a preceptor, I think you get a lot of enjoyment out of that because you don't realize sometimes how smart you are. And when you have to turn around and go, oh, wow, yeah, why did I do that? Well, let me tell you. And you can really see that it reinforces then their learning, but it also reinforces your value to yourself too.
Well, thank you, Julie, for all of that information. It was really helpful, and hopefully people were able to get a lot of great information about being a preceptor.
I think it was very, very valuable having you here to share that information.
Yeah.
Our students are very lucky that they have nurse practitioner or facilitators or preceptors that are doing this because they want to do it, and it makes for a great experience for them. And we as faculty and practicing NPs at the College of Nursing are also very, very appreciative of any person that steps up and is a preceptor, because we know that it's time consuming. We all also are preceptors for a lot of our students as well. And so we know that there is a commitment to this and a time component, and just worrying about someone else. I mean, when you go in and have a schedule in front of you that you know you have to get through, but you have to worry about somebody else sometimes at first, it takes a lot. And we truly, truly appreciate our preceptors and know what it is that they are bringing to the table. If you want to be a preceptor, certainly wherever you are, you can reach out to Lindsay or I, and we can make sure that happens. But you can also reach out to your professional organizations. I know here in Ohio, we have the Ohio Advanced Practice Nurse Practitioner Group, and they will post their students that are looking for preceptors or people who are looking to be a preceptor. And then, certainly other organizations that are out there that can enhance your role as a preceptor. NOF, which some of you may not know what that stands for, but that's the National Organization of Nurse Practitioner Faculty, and they have done some nice little vignettes and things to help people precept. The American Association of Nurse Practitioners as well has information, and we at the college are developing a really great interactive website. It's not live yet, but it will be, for our preceptors to go and get support and information and clarity, and because we're really trying to make sure that this is a great experience, certainly for the student, but also for the preceptor. We truly value our preceptors and want to make sure that that they have what they need to be successful, because you want to be successful as well.
Yes. So I think at this time we would like to open it up if you have any questions. And perhaps we would suggest typing them in a text.
There should be a chat window on the right side of the screen. You can type in there. Feel free.
And if you've been a preceptor and you want to offer any information, or if you have been or you're a student looking for a preceptor, or someone who's thought about it but didn't think they were ready or didn't think they had what it takes, I think it's important just to touch again on what Lindsay had said about, just because you don't feel like you know enough, that we want you to realize that it's certainly it's a two-way street, and we've all had preceptors in all of our lives that were great preceptors, and that's who we certainly want to emulate. But you want to think about, what did they do that made you feel good? Was it just that they were, sometimes being absolutely brilliant is a little scary, but sometimes it's just that person who heard you, who helped you connect the dots, who smiled. And the other thing that we really want our students to do is to feel like they're part of the team. And one of the important things that we ask our preceptors to do is to make sure that they introduce them to the rest of the team, and everybody knows who they are and why they're there and how long they're going to be there, so they can feel like they are truly part of a team in an organization or in a setting. So anybody have any questions?
All right. Well,
we really appreciate
thank you for being a part of this.
Everyone being here. This is hopefully has really enlightened some people and maybe sparked some fire in people to reach out and be a preceptor for the University of Cincinnati College of Nursing. Again, I'd like to thank Julie Shelton for being here and sharing her expertise and her real personal experience with being a preceptor. And our emails are here, so if you have a question later that you think of for either Lindsay or myself, please feel free to reach out and ask us whatever you might have on your mind. And have a great rest of your day.
Thank you
so much.
Everyone. Have a great day.